Hello, Jake. Before you start your training program here at the gym, it's just a few things we need to run through, questions and consent to make sure that you're okay with working in a gym-based environment.
Okay.
To make sure. So if you just fill this in just question by question.
Okay.
So, are you under the age of 18?
Yes.
Then once you're in the gym, you'll be capped at doing certain exercises and certain weight limits.
Okay, yeah.
Obviously then male or female. Working onto that is what do you want to achieve from your training program?
Just want to get stronger, get a bit more toned.
Gain some more muscle.
Yeah.
Any particular sport you're looking to do it towards?
Football would be the best one. Yeah.
How's your current diet?
Not very good. It's just a lot of meat and potatoes.
That's good. A lot of carbs, a lot of protein, sort of help you get in sort of the body shape that you want it.
Yeah.
Do you have any sort of injuries at the minute?
No.
No injuries. Any chest pain of any sorts?
No.
Any sort of dietary requirements that might be a problem?
No.
That's good.
Clean.
No injuries, no health conditions.
No.
And once you've done that, just sign at the bottom there. And then the other one is just our informed consent, just to make sure that you're okay with you have no sort of diseases or injuries that can impact working in the gym, making sure that you're good enough physical condition and prevent from injury, and you'll be fine with weights and stuff like that.
Okay, yeah.
You fine with that?
Yep.
We're going to do now just a few basic tests so we can get some data on it and how we can sort of shape your training sort of routine from that.
Okay.
The first one that we're going to do is taking your blood pressure, just so we can, when we set out your training program, that we know how hard to work you and to what limitations that your body's able to work at.
Yeah.
Let's just put this on your arm. Secure?
Yeah.
Just start now, it should be starting anytime now. Should be getting tighter around the arm now, just measure the blood pressure and the pulse. Should take about 30 seconds or so.
Okay.
Have you had this done before at all?
No.
We're looking, if all goes well, what I'd expect to be sort of a reasonable score is anywhere between systolic 100, anywhere below 120 roughly, and for diastolic anywhere under 80, that put you in the normative zone.
Mhm.
Anything above will just work around, but shouldn't be too much of an issue.
Okay.
109 for systolic, that's great, that's healthy, that's normal, and for diastolic 62, that's also good, it's under 80. So for blood pressure wise, that's all good. I'll just take a second reading,
Okay.
just to make sure that it is right. Yeah, it should be starting again now. Afterwards, we will also be taking your flow chart, just to, your peak flow, just to see your breathing, your ability to exhale. Again, just making sure that when we design your training program, that nothing is unusual or anything we should be aware about.
Okay.
Your first readings, they were just coming down again. Yes, same sort of readings. They're a little bit different this time. Systolic 123, but pre-hypertension. But if we take the average, I would say that systolic-wise, you are in the normal healthy category. Same for diastolic, a little bit lower than before, 59. But again, you're in the healthy normal category.
Yeah. Okay.
So just take this off. Just a second time. The second test is the peak flow, just to test your ability to exhale. 3 goes at this, and then how far you breathe will be shown with the red marker on the test.
Okay.
Blow into it. That's 600, that's very good. Just do that again, please. Just below 600, same sort of again. Just above 600, that's quite high. That's good, that's nice and positive. That's, from what we can see with your blood pressure, that you're very healthy, you're very active, lungs haven't got any sort of blockage, you don't smoke at all.
No.
Then that should be alright, and then the next sort of week or so we'll give you a call back and tell you how you've got on with how we've designed your training programme.
Okay, cheers.